If we pose this question in a generalized theoretical manner, it implies that everyone is a candidate for a facelift surgery. The nature of the facelift itself is very important here, since what we fundamentally define as a facelift encompasses procedures ranging from a forehead lift, a brow lift, and what we term temporal lifts, mid-facelift surgeries, total facelift surgeries, or neck lift surgeries. We essentially classify all of these under the umbrella of facelift surgeries. Similar to how we perform brow lift operations on patients who are 20 to 25 years old, we can also perform facelift procedures. We can perform total facelift surgeries on our patients aged 70 to 75. Consequently, the general response to the question of who is eligible must be that everyone is potentially eligible. Here, we must define our indication very clearly. What is the patient's complaint? The surgeries we perform most frequently within the facelift group are brow lifts in first place, and second, mid-facelift surgeries, and thirdly, total facelift surgeries. With brow lifts, we only change the brow position overall. But just like in the other operations I conduct, achieving a natural look is indispensable for brow lift procedures. It is certainly not a scenario I prefer or enjoy, lifting a patient's eyebrows during surgery to look like an alien or very exaggeratedly is not a result that I particularly favor or find pleasing. We mostly apply this to younger patients. The mid-facelift, meaning the middle facelift surgery, is a procedure we mostly perform on middle-aged patients, for example, between 35 and 50. When examining the components of this specific surgery during mid-facelifts, we elevate the eyebrows, we perform lower eyelid aesthetic surgery, and we reposition the descended cheek tissue to its correct anatomical location, which is slightly superior to the zygomatic bone or cheekbone. They are surgeries with very pleasing results. Chronologically speaking, using a mid-facelift procedure, we are capable of making a patient appear 10 years or sometimes even 15 years younger. In total facelifts, we prefer them when the defect is large. The problem is deformity, where there is significant laxity, and typically for patients who are somewhat more advanced in age. It generally begins around the age of 50, and naturally there is no upper limit, like 70 or 80, 90, provided that the patient's overall health status is adequate to receive anesthesia and undergo this particular operation. Of course, in a total facelift, we are stretching the entire face totally. In any case, looking at it chronologically, the patient can appear 20 years, perhaps 25 years younger than their current age. And these are essentially the average 1 day or a maximum of 2 days in the hospital. For example, a brow lift can be done without any hospital stay, no admission needed. And the results are quite pleasing surgeries. So, to determine which part of the facelift, we need to examine you in every case to determine if the size is appropriate, and after the examination, we will make our surgical indication and decision together.